Our top story, Prime Minister Narendra Modi said today that the world's biggest inoculation drive against coronavirus is set to begin in the country a day after the drugs regulator approved 2 vaccines for restricted emergency use. India's drugs regulator on Sunday approved Oxford COVID vaccine Covishield, manufactured by the Serum Institute, and the indigenously developed Covaxin of Bharat Biotech for restricted emergency use in the country, paving the way for a massive inoculation drive, though we don't have any date on it yet. Here's what the Prime Minister said.
भारत के वैज्ञानिकों ने एक नहीं दो मेड इन इंडिया कोविड वैक्सीन विकसित करने में सफलता पाई है। भारत में दुनिया का सबसे बड़ा कोविड वैक्सीन प्रोग्राम भी शुरू होने जा रहा है। इसके लिए देश को अपने वैज्ञानिकों के योगदान पर बहुत गर्व है। हर देशवासी आप सभी वैज्ञानिकों का, टेक्नीशियनों का, सबका कृतज्ञ है।
So far we have no word on when that inoculation drive will start, which is going to be the biggest in the world. Well, to talk more about the vaccines, we're joined by Dr. V.K. Paul, member Niti Aayog Health. Sir, thank you so much for joining us on the show. What can you share about the inoculation plan? We do know that in the United States, where the vaccine was approved some time ago, there's been a lot of criticism about how slow the vaccine rollout has been.
Well, I don't have any comment to make on the vaccination program in another important country. I would say that when we will mount the vaccine implementation program, we will be doing so on a platform of a very successful universal immunization program and in very practical terms on the experience of conducting national elections over a short period of time nationwide. Those experiences which deal with systematic provision of services and access to services will be useful deep down at the booth level, close to the community. So we hope that using the technology bandwidth that we have, the experience that we have, this will not be the case. Remember, in India, more than 65 crore doses are given each year to pregnant women and or children, and more than 9 million vaccination sessions are held each year. This is a very, very deep and extensive and a sustained experience that will now come handy for the bigger challenge, and we believe with the help of the people, with the help of media, with the help of administration and the SOPs and technology, this will be a very smooth affair.
Right, so now there has been a controversy over the approval to Covaxin, the Bharat Biotech vaccine, because the third phase trial isn't over yet. Also, the efficacy data has not been made public. Many scientists and experts are questioning this.
Well, we must appreciate that the licensure for emergency use that has been given by the Drugs Controller General of India on the advice of the experts has a few specific elements. Firstly, it is a vaccine which has a whole virus vaccine. This is a virus which is injected, and the body makes antibodies against several antigens, several protein elements present on the body of the virus. This is different from other vaccines or several vaccines which are only targeting one type of antigen, which is typically the spike protein. But this vaccine does not only cover spike protein, but also excites antibodies against several other proteins. And therefore, it is a much more hardy vaccine, which will not be affected should any mutations happen in the virus. And therefore, in the face of mutation-ridden situation, an outbreak, this vaccine will come handy, and this aspect has been highlighted by the subject expert group. Secondly, because of the fact that the third phase 3 trial of this vaccine is still going on, the vaccine implementation and usage will happen in the clinical trial mode. That means the beneficiaries would be watched as if they are part of a clinical trial in terms of their monitoring, in terms of their sampling, and in terms of measurement of the impact on them. So these two aspects are unique to the permission that has been given. But remember, this is a vaccine which will be an additional part of our armamentarium and arsenal in the face of a raging pandemic, which has hurt individuals, families, economy, society, and has led to loss of lives in a significant way. So this provides us a complementary approach and a complementary tool to take care of the effects of the pandemic and to ultimately slow down the pandemic.
Right, sir, but don't you think there needs to be more transparency, more data needs to be made public so that these, these doubts and questions, this politicization doesn't take place?
Well, surely more data is needed, and more data is needed for all the vaccines, because the vaccines that are being licensed in the country and outside are all emergency licensures. The full licensure will happen only when all of them will complete their phase 3 trial with full follow-up. So surely more data will be needed, and more data should be made public and will be made public as it unfolds. And the data also on the beneficiaries of the vaccine would be made available. Data on the phase 3 outcomes will be examined in a rolling evaluation way by the Drugs Controller General of India and his team. And therefore, no doubt, this is an emergency licensure because the full formalities are not yet over. But that applies to all the vaccines that are currently being licensed for use as of today. And therefore, continuation of the clinical trial for all the vaccines, including Covishield, including Pfizer, including Covaxin, will continue, and more data will be presented, will be evaluated, and further decisions taken.
All right. Thank you so much, Dr. Paul, for speaking to us. Well, to talk more about the vaccine and the program that we don't remember have a date on when the vaccination will begin. We're joined now by Dr. Hayman Deshmukh, Dean, KEM Hospital. Sir, what is your response to, the approvals that were given yesterday and also this controversy over the Bharat Biotech's Covaxin? Many experts are pointing out about how the phase 3 trial isn't complete and how, the efficacy data is not in the public, though the government has given some kind of an explanation saying even now it will be, administered as if it's still as if the trial is still taking place.
Yeah, the ICMR and NIV have joined together to have a larger database of Covaxin trials. And this Covaxin trial is going to be an extension of what has happened in the animal species. About 800 animal species were inoculated in the first phase and the second phase. The third phase, we have about 22,500 subjects for the Covaxin itself. And the data which is generated from a small sample of 22,500 subjects or volunteers is inadequate as far as the immunogenicity and the safety data is concerned. However, the vaccine is going to be rolled out irrespective of what happens in the initial phase 2 or phase 3, because this is going to be an emergency authorization for use of these vaccines. Now, the basic scientific difference between Covishield and the Covaxin is that the former is a virus which is not inactivated, but the Covaxin is a virus which has been inactivated. So basically, there will be a major difference between who gets what. If a patient or a volunteer is in a high-risk group or the elderly age group, I think Covaxin is the ideal candidate to be vaccinated. And this Covaxin is going to be immunogenic also. And we really do not know at this stage, unless the third phase is completed, whether this is going to be an efficacious vaccine against corona or no.
Right, absolutely, Doctor. That seems to be, the confusion. Of course, for laymen, you've explained it in very scientific and medical terms very clearly there. But to understand, also with experts saying that, the government, in fact, saying that it's going to be a backup. That if we fall short of the Covishield vaccine, and then Covaxin is a sort of a backup vaccine. What does that mean?
Basically, what it means is that initially there was always a thought whether, both vaccines have to be inoculated on 2 occasions, that is 1 month apart. And the number of subjects that is going to be vaccinated is going to require a number of doses, that is twice the number of subjects. So if the vaccine stock is inadequate, we can always visualize 2 things. One is number of vaccines can be increased, or the vaccinations itself can be a single dose vaccine also. So these are 2 different thoughts where if there is an inadequacy of supply of a vaccine, the shortfall can always be met either through a single dose or multiple vaccinations in 2 different age groups.
Right, and we also know that Bharat Biotech has got permission to vaccinate those above 12 years of age. Now, it was already doing this in the first and second phase of the trial, but in the third phase as well, it's going to be testing on children or vaccinating children above the age of 12. How significant is this?
Now, in the third phase of Covaxin trial, though KEM Hospital is not one of the participants in the trial, but the volunteers that were chosen are definitely not the pediatric age group. So we try to extrapolate the vaccine-related side effects or the vaccine-related adverse events from the adults onto the pediatric age group. But we still think that the pediatric age group is much more tolerant to either of the vaccines, either the coronavirus Covishield vaccine or the Covaxin itself. So using these vaccines in the pediatric age group is not going to pose a larger problem at all. And I still feel that both the vaccines are going to be safe in the pediatric age group also.
All right. Well, thank you so much, Doctor, for joining us, and you're staying on for our viewer question segment as well. But let's turn our focus now to the United Kingdom, and Prime Minister Boris Johnson there on Sunday faced calls from experts and opposition politicians to impose a nationwide lockdown in England as coronavirus infection rates reached their highest levels on record. Johnson said earlier in the day that the onerous lockdown restrictions were likely as a variant of the virus has pushed the daily case beyond 50,000 for the past 6 days. In fact, the President of the Public Health at Royal Society of Medicine, Gabriel Scally, told a British broadcaster that without a lockdown, the virus was going to gain a tighter and tighter grip across the country, which UK's vaccine rollout would not solve. In fact, a former UK Prime Minister Tony Blair also urged the British government to reconsider its strategy and step up its coronavirus immunization program. Blair said that the government should mobilize resources on a scale that has never been seen before in peacetime in the country, and recommended that the whole country should be placed under a COVID inoculation program. Well, to talk more about this, we're now joined by Dr. Vikram Talukdar. Thank you so much for joining us again, Doctor. And you're someone who is a volunteer in the Oxford vaccine program, and that vaccine is now being rolled out in the UK. But first, about the situation in the UK, it sounds very, very grim, and possibly a stricter lockdown.
Thanks for having me on the show, Gargi. Yes, the cases have risen. It's a little bit of a difficult situation right now. That's because the new mutant virus strain seems to be spreading very fast. As we know, it's about 50 to 70% more transmissible. And it looks like the hospitals are under a considerable pressure. Many of us who work in the hospitals have had to be redeployed to help the frontline staff, to help the ICU or the intensive care units, because the number of patients who are being admitted has increased. And that was exactly what was being expected from this new strain. The lockdown is probably imminent, and that's because the only way to really stop more people coming to hospital and stop admissions is to get some time, buy some time by letting people stay in their homes. So there were already Tier 4 restrictions. You could only go out of the house if it was really necessary. But it looks like there may be even stricter restrictions imposed over the next few weeks. And that's because you want less and less people to get this virus and come to hospitals.
Right, and how's the vaccination program been rolling out? We know in the US there's been a lot of criticism about how slow it's been. How has it been there in the UK? Now the Oxford vaccine, we were just getting the first visuals of the Oxford vaccine also being administered. So tell us a bit about that.
Well, the good part of it is that the vaccination drive is full on. We've already had about 1 million people vaccinated, first with the Pfizer vaccine, and from today the Oxford vaccine is being rolled out. People are quite positive about vaccination. There's actually quite a lot of interest where more and more doctors or dentists are trying to enroll themselves so that they can actually administer these vaccines throughout the country in their own place of practice. The question is, I think, can the production and the availability of the number of doses keep with the rollout of the vaccine? So they're really trying hard to get more and more doses produced. Also, the distance between the first dose and the booster is now about 12 weeks. So the initial idea was to give the first dose and follow the second dose in 21 days or 28 days. That's what the vaccine manufacturers recommend. But we know that most protection comes from the first dose. If you've been given the first dose, then it's very likely you will be protected against severe illness or death. So the plan now is to give first dose to as many people as you can, and you can delay the second dose slightly. So you can give it in 3 months' time, about 12 weeks' time. That's exactly the strategy that's being now rolled out by the public health. So hopefully we'll win the race of vaccination versus how many admissions we are getting in the hospital. That's going to be an ongoing sort of race for the time being. In 2 or 3 months' time, as the vaccination numbers keep increasing, and the aim is to actually vaccinate all the vulnerable population, about 30 million by Easter, we'll be in a much better place. Fingers crossed.
Right. Well, we're seeing again those visuals of the AstraZeneca vaccine being administered, and here in India also we're hoping that we will get it soon. I also wanted to ask you about these reports that were floating around, and these were not confirmed. In fact, perhaps even denied, that children are getting more affected by this, different variant of coronavirus.
Well, actually, its new transmissible strain is much more faster in terms of spreading in children. So they can usually, what you see is as the numbers go up in terms of the community, as the virus spreads more, you're expecting more children to catch this virus and then transmit it to others. So they become spreaders. But in no way this strain is more lethal or more deadly or more dangerous to children. So it's really important that a message goes out there that this strain is not anything different from the previous strain. It's not more dangerous. It's just that more children will get it because it spreads quickly amongst children.
Right, and coming to what one of the experts said, that the vaccinations have to be conducted at a much higher speed. Otherwise, it will be it won't be enough to counter the spread of the virus that we're seeing right now in the UK.
Well, yes, I mean, it's going to be a combined strategy. One is to do a little bit of lockdown wherever there are hotspots of such virus transmission, so that you buy time. And in the meantime, we are going to try to keep increasing the number of people who are being vaccinated. So there's no doubt that there is a race here. We've got to keep up the vaccination numbers high so as to let people get vaccinated so they don't have the disease and they don't turn up to hospitals. That's absolutely true. It has to be lockdowns as well as vaccination as a priority now, so that less and less people contract this virus.
All right, Dr. Vikram, thank you so much for speaking to us here at NDTV once again, and and also, as we said, great to see that the Oxford vaccine process rollout has begun, and that's something that you had actually volunteered for when they were doing their first trials on volunteers. Thanks again for joining us. With that, time for us to slip into a short break. On the other side, we'll have our viewer question segment. Stay with us. Welcome back. Well, it's time for our viewer questions on the show, and joining us is Dr. Hayman Deshmukh to take all those questions. Let's listen into the first one.
Hello, doctor. I'm Michelle from Delhi, and my question is it mandatory to take the vaccine even if the person has already been through COVID?
Right, doctor?
There are two things here. One is this vaccination program that is being rolled out is going to be a totally voluntary program, and anybody who is volunteers for the vaccination will be vaccinated, and anybody who has undergone or who is affected by COVID and he has recovered in the later months or weeks, I think the antibodies that the volunteer or the patient has developed will decide whether he needs to be vaccinated or no, because this category of patients will be from the general population. However, healthcare workers who has recovered from COVID will definitely be measured by his antibodies in his blood, whether he needs to be vaccinated or no. So it is not really necessary to be vaccinated if your antibody levels are very high.
All right, and I think by the time it reaches Michelle, it'll be many, many months to go. Let's listen into the next question.
Hello doctor, this is Alok from Delhi. I would like to ask you that Bharat Biotech vaccine has been approved without data from the third phase trial. In such a situation, how safe is the vaccine?
All right, so we're back to our initial discussion on the show,
Yeah.
but yes, go ahead, doctor.
Yeah, so there are two things here. This Covaxin from the Bharat Biotech has undergone phase 1 and phase 2 clinical trials on animals, and it has up till today about 22,500 human beings are being vaccinated against this coronavirus. So the immunogenicity that this vaccine develops is going to be measured, and the efficacy will be subsequently known to us. So only after the efficacy and the immunogenicity results are known, this Covaxin can still be a reserved candidate for vaccination.
All right. Well, thank you so much, Dr. Hayman, for joining us and answering those questions.